Good evening, everyone. We are from the University of the Philippines Open University, and we are going to present our project entitled Development of a Web-Based Related Learning Experience for Nursing Students in an Open University. Let's start with the background of the study. The suspension of classes due to the pandemic has presented students, educators, and administrators with a multitude of extraordinary challenges. A few weeks after the lockdown in the Philippines, the Commission on Higher Education issued an advisory allowing higher education institutions to deploy available flexible learning and alternative modes of delivery. The goal of these memorandums was to encourage students to continue learning despite the ongoing pandemic. But even with the innovations made by Philippine education institutions, there are still challenges and concerns. Nursing educators struggle to find ways to transfer knowledge to their students, particularly in giving critical clinical experience. Students' clinical practicum is an important aspect of nursing education and is commonly referred to as related learning experiences. RLE is unique to the nursing discipline like other health-related professions because it applies theories, knowledge, and learning acquired during classroom discussions and establishes nursing students' healthcare skills under the direct supervision of professional clinical instructors and nurses. The focus group discussion conducted during the initial phase noted that finding a learning material was one of the many challenges that these educators have experienced. They have to think of alternative ways to deliver their learning objectives, at the same time improvise materials that are patterned to their manuals. Preparing these materials was difficult for them because of different factors, such as lack of time and funding. Connectivity was also a problem during the transition. The Philippines' average internet speed is much slower compared to other neighboring countries. Educators were also emotionally and mentally drained because of the sudden transition to online learning. The objectives of the study. The purpose of the study is to develop a web-based RLE design that provides students with an alternative activity for clinical learning experiences without the use of computer-generated imaging and a useful platform where they can see a 360-degree view of various clinical setups and simulations.
The study utilized the Successive Approximation Model, or SAM, developed by Dr. Michael W. Allen. This model employs rapid prototyping as its methodology and considered an alternative to more conventional models such as ADDIE. The project, like SAM, is also divided into phases. In the preparation phase, needs were assessed. Program scripts and other product requirements were also created. During the iterative design phase, video shootings, system design, and the platform for the web-based RLE were planned and developed. After the final shooting was conducted, videos were edited and rendered. At the same time, the IT team is improving the system design for the prototype stage, which is the development of the web-based system. The project is currently in its iterative development phase, with the program faculty members implementing the prototype in their classes. Evaluation shall be done after the semester. For the methodology, we employed a quasi-experimental research design to develop the web-based RLE. The researchers explored the challenges that the nursing educators experience and use it as the basis for the development of the web-based RLE to implement to the nursing students. The participants were faculty members and students from the Master of Arts in Nursing program in an open university who struggled with their teaching and learning objectives for related learning experience during the pandemic. The first phase is needs assessment, where we evaluated and critiqued the existing academic solutions implemented in the first semester of academic year 2020 to 2022 to address the concerns. The researchers developed case studies for each specialty and templates for the writing of the simulations program scripts. The case study template contains the title, focus area, scenario description, scenario objectives, setting, required equipment, and scenario implementation.
After the conceptualization phase, during which case studies for each specialty, adult health nursing, maternal and child nursing, gerontology and geriatric nursing, and nursing administration were identified. The scripts were written in subsequent online meetings via Zoom. We also identified team members such as the director, editor, graphic designers, and actors. There was a pre-conference wherein nursing experts advised on scene execution. Before filming, the team rehearsed and tested the camera angles. The final filming of each case scenario took place at a tertiary hospital, which effectively portrayed a nursing station and the hospital facilities needed for the courses. The study requires the 360-degree camera to familiarize students with various medical settings. The team edited and rendered the simulation videos from final shootings to upload it to the respective YouTube channel, as it does not hinder the website's performance since handling 360-degree videos is different from the regular videos.
It is because a 360 camera uses two lenses that shoot 180-degree field of view each. Then the 360 camera will have to stitch those videos that are taken from the two lenses so that the final one is seen as a 360 video. With this, the team explores different video players such as the Video.js, Player, and Clapper, which are open source video players that supports 360 videos, to know which is appropriate for the site. At the end, the team considered YouTube as this is a known video platform on the web and it supports a 360 format. We also designed the web-based related learning experience online platform that caters teachers and students separately. Students can view and review videos and answer questions for all courses they are enrolled in. Teachers can give access to students, navigate class lists, study descriptions, supplementary files, and links. Teachers can upload and edit videos, video thumbnails, and questions on every video seen.
The authors are currently implementing and monitoring the web-based RLE. Evaluation shall follow, which will be participated by students enrolled during the second semester and faculty members. This shall be done using the use survey. There will also be a post-conference to conduct a SWOT analysis and appraise the program using the feedback from the users.
So for the benefits of the web-based RLE design, first, it is highly beneficial that the students and teachers participating in the study have prior experience with online and remote learning. Since the team decided to conduct the video in hospital setting, it promotes learning in the actual environment. Another advantage is that it allows students to learn practical knowledge without exposing patients to any risk. The web-based RLE design will help the students to test their theoretical knowledge and also practice clinical skills to mastery since repetition of process is possible with simulations. As a result of the web-based RLE design's incorporation of real-world context, learners can complete the learning process by reflecting on their performance. That's the end of our presentation. Thank you.